I'm Dr. Ken Landau. Thanks for watching. Let's talk about Depo-Testosterone or testosterone cypionate. It's an ester of testosterone. The FDA approved it in 1953 as an intramuscular injection. It has no oral form and it has no intravenous form. It comes either as 100 milligram or 200 milligram per milliliter, and the size of the vial is either 1 milliliter or 10 milliliters. It's an oil-soluble and water-insoluble product. It's a Schedule III controlled substance, so it's in the same family as suboxone and vicodin and ketamine. Since it's a testosterone ester, it's relatively slowly absorbed from the area where it's deposited in the muscle. So that way you only have to receive an injection about every 2 to 4 weeks. But it has a preservative, and the preservative is known as benzyl alcohol, and that can cause some mischief, as we'll see in a moment. Well, testosterone was originally isolated in 1935, has two major effects. One's a virilizing effect, so it seems to work on the androgen receptor either directly, or it might require conversion from testosterone to dihydrotestosterone. And in some tissues, it's the dihydrotestosterone that's the active ingredient. Also has anabolic effects. So the anabolic effects, it causes nitrogen retention, causes growth of the lean body tissue, causes growth of the muscle, shrinkage of the fat, also causes growth of the bone. Well, it's very important that you have adequate amounts of testosterone if you're a male in order to grow normally, for the growth and development of the male sexual characteristics, for the maintenance of those characteristics. It's important for the growth and maturation of the prostate and the seminal vesicles and the penis and the scrotum. Also very important for hair distribution. The beard hair, the scalp hair, the hair in the axilla and the genitals. Also important for enlargement of the larynx and for thickening of the vocal cords. Has this anabolic effect where it causes not only retention of the nitrogen, but it also causes retention of the sodium and potassium and phosphorus. It causes the kidney to decrease the amount of calcium that's being excreted so that you can build some bone. So it tends to stimulate growth of tissue and it stops the breakdown of tissue. But obviously you have to get a sufficient amount of calories and protein in order for it to work. Well, it also works on the red blood cell production. It stimulates production of a chemical known as erythropoietin, and that causes the red blood cells in the bone marrow to be made in a much higher concentration. And that's important certainly if people have anemia that's been evaluated, you can't find any cause of the anemia. Well, in some individuals it's appropriate to use the testosterone to stimulate the erythropoietin, and it can do that and correct the anemia in more than 50% of the people compared to a very small percent in the people who receive placebo. Now, in addition, it's important for linear growth. But not only does it cause linear growth, it also causes fusion of the growth centers, the epiphyses. And when it does that, it stops the further growth. Now there's an issue. Your body manufactures testosterone under normal circumstances. And if you receive exogenous testosterone, like the Depo-Testosterone, shot of testosterone, well, then that's going to cause your body's natural production of the male hormone to slow down or stop. So the testicles shrink. And then in addition, the sperm aren't produced either as much or at all. So who needs some kind of testosterone replacement therapy? Well, people who are deficient for one reason or another. So people who are deficient because they have some abnormality of the testes, that could be a congenital or an acquired problem, maybe cryptorchidism, or maybe the person had some surgery or bilateral torsion, or more likely, the person has something called Hypogonadotrophic Hypogonadism, which basically means that either the pituitary gland or the hypothalamus not able to send the messages to the testes to go produce the testosterone. And this could be resulting from some sort of tumor or some trauma or radiation therapy. And one of the problems is as men get older, the testosterone production decreases at the rate of 1.5% per year, and that might lead to age-related testosterone deficiency or late onset hypogonadism. And it might be that Depo-Testosterone is a treatment for that. It's arguable, however. Well, who shouldn't receive the medicine? Certainly if you're a pregnant woman, it's teratogenic, causes fetal harm, causes virilization of the fetus, and that benzyl alcohol crosses the placenta and causes some mischief. It's not good for nursing women, and actually we don't have good evidence that it's safe or efficacious for children under age 12, because remember, it could cause some problems with precocious puberty. Well, if we look at the testosterone in the system, it's mostly bound to sex hormone binding globulin or albumin, so it's not mostly circulating in a free form or an active form. The testosterone is going to be inactivated in the liver. It's going to be metabolized to a variety of different substances called 17-keto steroids. The half-life is going to be about 8 hours. 90% is going to go out in the urine. 6% is going to go out in the feces. Adverse effects of receiving Depo-Testosterone or any testosterone could be enlargement of the male breast, could be excessive, frequent, or prolonged duration of the erections, could cause decrease in the sperm, cause acne, cause oily or greasy skin, cause hirsutism where you don't want it, growth of hair where you don't want it, and lack of hair where you do want it. It can change your libido, either increase it or decrease it, but it certainly can lead to either subfertility or infertility, can lead to headache, and remember, it causes red blood cells to be made, so it could cause too many red blood cells to be made. You could develop a polycythemia, it could clog up the vessels. Don't want that because it could lead to deep vein thrombosis and venous thromboembolism. People can become allergic to it. And certainly with the injection, it could cause some pain and inflammation at the site. Also causes retention of sodium and water. So if you happen to have heart disease like congestive heart failure, this isn't an appropriate therapy. Also causes retention of calcium, which might lead to a variety of other problems. Causes retention of the nitrogen and the phosphate. It can cause hepatic toxicity, liver toxicity, or even jaundice. It can change the liver function tests, and in rare individuals can lead to hepatocellular carcinoma or a medical condition known as pileosis hepatis, and that's where inside the liver there are these little islands of blood-filled cavities. They could range anywhere from a couple millimeters to a couple centimeters. Makes the congestive heart failure worse, but there's an issue about whether it causes heart attacks and stroke. Watch my show on age-related testosterone deficiency to learn more about the updated information. Can cause some major psychiatric abnormalities, major depression or mania or paranoia, or cause delusions in some people, hallucinations, hostility, and aggressive behavior. And in some men, can lead to convulsions and irritability, can alter the cholesterol level. So as a result, people who are on therapy need blood tests periodically to check to make sure you're not making too many red blood cells, to make sure your cholesterol isn't going crazy. And also, if you happen to be diabetic, we know that the testosterone seems to be associated with a decreased requirement for insulin. So you have to check to make sure your blood sugar isn't going too low. And we also know that it can cause some abnormalities of the thyroid hormone, but it doesn't really cause thyroid deficiency or thyroid dysfunction. And if you happen to be taking an oral anticoagulant, can change the effectiveness of that. Well, women who are taking the Depo-Testosterone, they can develop, again, hair where they don't want it. They can develop loss of hair where they do want it, the male pattern baldness, menstrual irregularities, shrinkage of the breast, enlargement of the clitoris, and probably some deepening of the voice. Children, if they receive injections of the testosterone, well, it could cause premature closure of the bony epiphyses, so it could limit the ultimate height that the child would otherwise achieve. And it also can cause precocious puberty. That's why it tends not to be used in children who are less than 12 years of age. The idea about carcinogenesis, well, it's really tough to say. Certainly in animal models, in mice and in rats, can cause tumors of the liver, unquestionably. Does it do that in humans? Well, if we're talking about the Depo-Testosterone, the testosterone cypionate, no, tends not to do that. Rarely can be associated with hepatocellular carcinoma in long-term high-dose therapy. There's always the question about, does it increase the likelihood of cancer of the prostate? Does it increase the likelihood of benign enlargement of the prostate and difficulty urinating? Again, watch my other show on age-related testosterone deficiency for that. But the answer is probably a lot less than most people have thought over a period of time. Now, if you receive a different kind of androgen, 17-alpha alkyl androgen, this is a beta androgen with the testosterone cypionate or the Depo-Testosterone. Well, with the other kind, the 17-alpha, that could lead to potentially life-threatening hepatic adenomas and hepatic carcinomas and pileosis hepatis. And it certainly seems that an older population may suffer from some genitourinary problems with that kind of testosterone. Well, if a person received Depo-Testosterone, there's a small increase in the deep vein thromboses theoretically, and that may be manifest as some pain or warmth or redness of the legs, shortness of breath. As far as the heart's concerned, again, watch my other show, because some information that came out from Kaiser in February of 2020 suggests that not only is it not really damaging to the heart, but it might actually reduce the incidence of heart disease. Now, there's a lot of abuse of the testosterone going on, and a lot of people using increased doses, and they're combining it with other anabolic steroids, and that might lead to some more complications. But this benzoyl alcohol that we talked about before that can cross the placenta and cause some problems in babies also causes something known as the Gasping Syndrome. The Gasping Syndrome, shortness of breath, especially cause death in the pediatric population. There's an unknown amount that's necessary for the toxicity to develop. But when you get more of the benzoyl alcohol than your liver and your kidneys can detoxify, that can cause some significant problem. Well, who shouldn't take it for sure? Well, people that we talked about, people who are hypersensitive to it, people who have active cancer that's being evaluated and treated, certainly shouldn't receive the testosterone, cancer of the breast, cancer of the prostate. Women who are pregnant, people who have serious cardiac or renal or hepatic problems. And if you're immobilized, remember I said it retains calcium. So you don't want too much retention of calcium if you happen to be retiring in bed or you're in a wheelchair. You have to be careful of how much medicine. Well, with these Schedule III controlled drugs, there's the potential for abuse. And unfortunately, a lot of people use these drugs for non-therapeutic use. They use it for the psychological improvement. They use it for the physical improvement. We see now in male and female adolescents. Used to be just that it was the elite athletes, the bodybuilders, who used the medicines. Now we're finding increasingly it's used in high school students, it's used in adults, and it isn't used necessarily just for the activities, the sporting activities or the bodybuilding. Since the 1980s, actually we've had about 1 to 3 million people who currently use the medicine, used for recreational bodybuilders and the weightlifters, but used for cosmetic purposes, more so than to enhance the sporting activity. So a recent web study was done looking at users of these kind of medicines. They looked at people who responded to surveys. There were about 230 men. They were over age 25. Mostly they were Caucasian. And it was found that a significant number of them use above the average dose, but these individuals tend to be relatively successful in life. They tend to earn more than the average population. They tend to use more testosterone, oftentimes use more than 600 milligrams. Often the men are married and self-employed. If we look at the place where they get the testosterone, about half of them get it from the internet, about a quarter of them receive it from a doctor, and a quarter of them receive it from overseas suppliers. And these men, probably 90% or more, are also using other performance-enhancing drugs. They're using anti-androgens like clomiphene and tamoxifen and letrozole. And about 60% of the men are using other 17 alpha-alkylated hormones. Remember, those are the kind that can cause the problem. Oxyandrolone, the stanozolol. About half of them using the cutting agents. These are like clenbuterol that's used for asthma or COPD in other countries, not in the United States. About 75% of the men undergo routine laboratory monitoring, and about 40% of the men have had some abnormality in the past. And about half of the men are using other illegal substances that they began before they were even using the testosterone. The reason the people are using the medicines, about a third of them it's to gain muscle mass, about 20% to lose the adipose tissue, the fat tissue, about 15% thought that they had low testosterone, they diagnosed themselves, about 10% were using it for bodybuilding competition, and about a similar amount using it just for the aesthetics. Complications that the men had from using the steroids? Well, about 86% of the men had some kind of complication, testicular atrophy in more than half of the men, acne in more than 40% of the men, fluid retention in more than 40%, overconfidence, painful nipples and gynecomastia, enlargement of the male breast, and fatigue. And when they stopped using the steroids, about 90% complained of loss of muscle mass, a decrease in libido, a decrease in the energy. And when they withdrew for weeks or months, then they complained of depressed mood or other major depressive symptoms, fatigue and craving and restlessness and irritability and anorexia and insomnia, decreased libido. They also developed that hypogonadotrophic hypogonadism because their testes hadn't been able to start producing the testosterone again. So if you're considering using testosterone, you want to have at least 2 non-consecutive morning testosterone levels drawn in a legitimate laboratory. You want it to be between 8 and 10 o'clock in the morning or thereabout. If you're going to receive this medicine, it's a deep dose into the buttocks. The amount that you need, well, it varies with your age and the sex and the diagnosis. It can be adjusted upward or downward. Typical adult male with hypogonadism could take in as little as 50 milligrams to as much as 400 milligrams every 2 to 4 weeks. Keep the vial at room temperature. Shouldn't be stored in cold environment. If it is stored in a cold environment, then it should be brought to room temperature so that any crystals that form are dissolved should be shaken before it's injected. It's not for intravenous use. And it's not the same, and it can't be used in the same dose as the testosterone. Propionate has a different duration of action. So that's the story with injectable testosterone. Supposedly it's for men who have low levels of testosterone due to either issues with the testes or areas of the brain known as the hypothalamus or the pituitary. But it's used between 1 and 3 million men who are using it for bodybuilding purposes or aesthetic purposes. And the side effects are real, but unfortunately the side effects are probably overblown. So watch the show on age-related testosterone deficiency because we go into some of the more recent findings. And if you do need the supplements, well, the American College of Physicians suggests that it's much more cost-appropriate, cost-effective, to receive injections rather than either the patch or the gel. Those are much more expensive, and they're not any more effective. So anyway, thanks for watching. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.